Thank you very much. Thank you, Professor Karim. Um, First of all, I would like to thank the organizing committee for giving me the opportunity to present some data that we have collected in the past 2 years. These data are part of our standardization process that we are following in our project. And I'm going to share with you data on the effect of hip strength and flexibility on football performance. And as you all know, groin injury is an important problem in football, and several risk factors are being involved. From the studies you know and from the presentations today, this morning, you have seen that most of the studies in most of the studies, players are being tested pre-season, and then we follow the players for the rest of the season and record the injuries. This is a nice method, but we might miss some data, and we might miss the effect of the effect of training load or match load on different individuals and on different parameters. An alternative strategy, an alternative approach would be to examine the players more frequently, however, and observe the variations in these measurements. However, to do this, we need easy to use and reliable tests. One such approach was presented a few years ago by a group from Australia, and as you can see, they have measured the adductor strength with the handheld dynamometer in Australian football players, and they have noticed that there is a change of about 6%, a decline of 6% before the onset of groin pain. What would be interesting to know is the minimal detectable changes. And let me remind you that minimal detectable change is the smallest amount of change in some measures that is not likely to be attributed to measurement variation. So the aim of our study was to determine the minimal detectable changes and the reliability of the hip flexibility and strength measures. And for the measures that were reliable, to examine the effect of match play load on these measurements. For the purpose of this study, 20 youth players were tested on 2 separate occasions, and after a familiarization trial, the players were assessed for hip strength with the handheld dynamometer and for flexibility with the bend knee fallout test. Intra-rater variability was assessed by 2 testers, and inter-rater variability was also assessed. The average of 3 maximum efforts was used for this analysis. And as part of the second aim, hip strength and flexibility were assessed 9 hours before and 14 hours after an international friendly match. The match load was estimated using the perceived rate of exertion and the time played. Intra-class correlation was calculated, and reliability was defined as good, moderate, or poor, and minimum and detectable changes were also assessed. This is the inter-rater variability for rater A and B, for tester A and B, and as you can see, the ICCs range from moderate to good. This is a more busy slide, but which presents the intra-rater variability for these youth players for 2 raters, rater A and rater B. And as you can see, and I would like to concentrate on the minimal detectable changes, there is a variation, there is a variability between the 2 in the minimal detectable changes. But I would like you to concentrate on the fact that when the measurement was performed by 1 rater, the minimal detectable change could be as low as 20.7% for flexibility, 17.3% for abduction, and 12.5% for adduction. This graph presents the player load, match load, and the percentile change in hip flexibility. Let me remind you, we measure the flexibility before and after the match, and this is the relationship we get, a curvilinear relationship. And in trying to explain this relationship, one way of looking at the data is that there is a threshold, or there might be a threshold, above which there is an abrupt change or deterioration in hip flexibility. This is one way of looking at the data, because there might be another way of looking at the same data. As you can see, there is a group of players for which there's no change in flexibility, no matter how much the match load changes. Whereas there is another group of players for whom a very small change in match load will result in very big change in hip flexibility. In conclusion, it seems that hip flexibility and strength measures with a handheld dynamometer presented moderate to good reliability in these young football players. Changes in strength and flexibility of more than 12.5 and 20.7% are necessary to be considered meaningful and not due to measurement variation. And it seems that there might be a relationship between match load and change in these measures. What are the practical applications of these first study results? That handheld dynamometer can be used as a reliable tool in everyday practice, which is very, very important for the everyday practice, and frequent testing might be conducted in a very nice way. Also, I would suggest that we should keep in mind that individual responses might be different when we consider the relationship between match or training load and the risk factor for groin injuries. For the rest of the presentation, I would like to present you the second study results, which is on the ability, the effect of strength and flexibility on the ability of the young players to change direction. You might know that the ability to change direction, we call it agility, is a crucial component in football performance, and many factors might influence this performance indicator. So far, the majority of the studies have focused on the association between the strength or power of the knee extensors and flexors, and very, very few, limited to my knowledge, data have examined the relationship of agility with other measures like the hip strength. On the other side, there is evidence in the literature that muscle output during dynamic muscle action is positively related to the tendon stiffness. So in looking at the literature, our aim for this study was to examine the relationship between hip strength and flexibility and change of direction in youth football players. And our hypothesis were that a greater hip strength would be associated with better change of direction performance. And the second hypothesis, that the high flexibility would be associated with lower change of direction performance. Again, flexibility and strength were assessed in 16 training youth soccer players, and a modified L-turn test was performed on both sides, on the right side and on the left side. And during the test, we measured the total time, but also the turn time, which is this segment of the run. These are the results from this study. And as you can see, no correlation was found between abduction or adduction and either total time to change direction or turn time, whereas a negative correlation was found between flexibility and change of direction total time. In conclusion, and as you saw in the last graph, there was a negative correlation between a player's hip flexibility and change of direction ability, and hip strength measures were not associated with the change of direction ability, at least in this group of players. We speculate that there might be other factors, since agility is a multifactorial ability. There might be other factors involved, such as rate of force development or muscle and power of other muscle groups. Thank you very much for your attention.